two, and one. All right, hello and welcome everyone to the Public Health Media Day update. My name is Cameron. I'm going to facilitate today. And as always, we're really happy to have our health officer, Dr. Andy Coren, with us today. So for the schedule, Dr. Coren will give his updates on all the public health kind of issues in the county. Then we should have a good 30 minutes for question and answer session with a number of our local reporters. And then we also have questions from the public coming in from YouTube and Facebook live streams. So we'll jump right in. Dr. Coren, hand it over to you.
Thank you. Put my microphone and my camera on so people can see my face. This is the first media day for the post-holiday season and the first in 2023. So though we've had a number of emergencies recently going on, the future is looking better. Now let's review the infectious problems that we've had in California and Mendocino County. First off, Mpox, the threat has decreased significantly, though California has not ended the state of emergency around that illness. At this point, the vaccines are available and current recommendations are for anyone who has had the first dose to complete the second dose. It actually doubles the protection compared to one dose. And if you think you need one, please request one from your provider. There is no scarcity of it. And we want to make sure that everybody who feels they need it gets it. The next slide is about Ebola. And the Ebola epidemic has been declared ended by WHO as of January 10th. And that's because there have been no reported cases for 2 incubation periods, which is their criteria. So the current additional screening recommendations have been withdrawn for Ebola virus. However, it's always a best practice for providers to obtain a travel history from people presenting with any unusual symptoms. Moving on to our winter virus. The winter virus season continues. We have the usual variety of winter viruses circulating. You can see on the right side of the screen the names. Just to clarify, there's a reference to ILI, that's influenza-like illnesses, because it's hard to distinguish these right off the bat. The upper left-hand slide shows how the percentage of outpatient visits for these influenza-like viruses have decreased, especially in the younger age group. We were very concerned with the peaks, that purple line among the 0 to 4-year-old. They're still the highest, but all of these age groups are showing a decrease in their presentation to outpatient clinics for these illnesses. So the only difference now, if we look at the bottom right-hand graph that shows what's happening with all of the different viruses, you can see that in January, they all seem to be coming down, and they are. But the larger pink line is our SARS-CoV-2 line. It does look like it's going down. It actually is not. That's felt to be due to the reporting that decreases over the holidays, but it is slowly increasing, or it was slowly increasing at the beginning of January. It's actually, they are starting to show a decrease in the number of COVID presentations, and that's what this slide shows, is outpatient visits. The other thing is that we want to go over on the next slide how this year compared to prior years. We were very worried about this influenza epidemic being one of the worst in years and years. And this goes all the way back on the left side of the screen to 2017-18, which was the worst in the last decade. And these are admissions from Northern California Kaiser that are being reported. The orange line is influenza, and you can see that it peaks in January 2018 on the left side of the screen, is significantly more than the peak in December of 2022. It was rising incredibly fast in December, but that seemed to level off, and it's definitely coming down. The RSV was the other major virus that we saw in December, and that was really threatening our hospital capacity, especially for the children. That's the blue line, and you can see that that was higher this year than it has been in the prior years, but it has leveled off and it's coming down. And finally, you can see COVID is in red. And although that was very high this season, and it came a little bit earlier than we expected it, it was not as high at all as a year ago, or even I'm sorry, 2 years ago, or January 2022, or even the summer fall of 22 of 21. I'm sorry, of 21. So we didn't hit as high numbers, and these were hospitalizations. So we distinguish between hospitalizations and cases, but it's much more reliable for us now to be going on hospitalizations to assess the burden from these illnesses, because the testing at home is not a reliable measure. We just don't get all of those reports in. We talked about RSV and influenza. Influenza did surge a month early, and it was going very high. It's been the main driver of hospitalizations in December, and it threatened to be the highest cases since 2017. But now, if we can go to the next slide, we can see that what's happened. Okay, here you can see all of the different viruses, the hospitalizations coming down on the left. This dark blue is the current season. It didn't come close to the surge in 2019, and it is. We're seeing it come down earlier as well. And on the right, you can see flu hospitalization rates that are all coming down in all of the regions of California. The brown line, and it's now at the top, is also coming down. It's very safe. And actually, Rancho, which is the Northern California Counties organization, usually trails the other counties, but is nowhere near the height of them. They don't peak as higher rate. And it was higher back in December, but it has come down nicely at this point. And the next slide, I think, shows that the admissions. Let's see the next slide. Oh, we're not. Can we go to the next slide and see if that shows us? No, it doesn't. Something happened with that. Anyway, the point is that influenza was the great cause of admissions back in December and the first week of January, but the COVID admissions is now driving hospital admissions more than influenza, although it's still not as high as it was in the past. The other thing is that the influenza, remember, is sensitive to the vaccines that are available, and it's advised for everyone over 6 months old. So if you do get the flu and you are diagnosed within a couple of days, starting that anti-flu medication will effectively prevent the severe symptoms and hospitalizations. So again, if you're sick, contact your provider early if you do think it's influenza. And I think we must have missed the slide that we had here in Mendocino County, but I already went over it. We are now seeing more hospitalizations, many more due to COVID than influenza. So COVID is the third of the viruses in what we were calling the triple-demic, and the cases and hospitalizations are actually decreasing now. And you can see that in this slide that shows COVID-19 admissions in all of the various regions. And you can see again at the bottom of this slide is the Rancho epidemiology graph, and it shows that the admissions are significantly lower than the other regions in California. The test positivity is coming down, though we don't listen to that too much since the amount of testing has gone down. The positivity was up earlier in the month and now seems to be plateauing and decreasing. But we also confirm that with our wastewater surveillance data. And now in the last month, Ukiah wastewater surveillance is occurring. And starting just in the last week or so, Fort Bragg has added that on. And we we hope that Willits will also add it on. It'll be a great way for monitoring and situational awareness. So the data now that I'm just going to go over is the test positivity in California is down to 6.1. But here in Mendocino, it is 7.9%. It was actually, we were doing better than California as a whole, but it's been changing so frequently that now California is a little lower than us, but that's okay. As of yesterday, the cases per day and averaged over a week, the cases were 5 per 100,000. And the hospitalizations, now these are averaged over 14 days, were 6 per day, and that was down 25% from the 2 weeks before. Outbreaks that are here in Mendocino County, there is only one in a skilled nursing facility, and it is resolving. It's not a large outbreak. The total COVID confirmed deaths is now up to 139, and the more recent ones are elderly people with significant comorbidities, and they actually passed away, several of them, the last few weeks, but because they were out of county, it took a while for us to get word of that. This extra 3 deaths, I think, were the first ones we've had in several weeks, and there was a plateau for even a few months before that. The adding of these deaths does not, at this point, indicate a trend. It's just this is how they were reported. Schools also, as you remember, distributed home testing kits before Thanksgiving and then before the winter break for the staff and students to test before returning to school. They did that. After Thanksgiving, there was a huge rise in absenteeism, but this time there was not a significant increase in absenteeism, and no outbreaks have been reported from our schools. The community risk level is intermediate at this point. So I wanted to go over some notices of changes that are happening at this time. The contact investigation unit that was working all through this pandemic valiantly and calling everybody who had a positive test, and we were the last county in the state to do all this contacting. We are stopping that process at this point. Notifications from our COVID team will be changing to automatic SMS and text messages as of January 23rd. And with that text message will come a link to isolation and quarantine information, as well as treatment information that we used to do verbally. And we'll still have the call center for any follow-up questions that people may have. Also, vaccines and testing by the OptumServe company that the county contracted with, that was available at the Ukiah Fairgrounds and at the VA in Fort Bragg. That's going to be ending because of way decreased utilization, and that's all over the state. Instead, Mendocino Department of Public Health will have vaccine clinics open now at 1120 South Dora Street at our office on Tuesdays, Wednesdays, and Thursdays from 8 to 5 p.m. And in Fort Bragg, they will be there on Mondays. I don't have a positive time. That'll be a half a day clinic. I'm not quite sure whether it's going to be morning or afternoon, and that will be on Mondays. And then as time goes on, we are hoping to be able to provide that service on Monday afternoons in Willits.
Marcy Angel or Susan Parker.
Let's see. We won't be doing PCR testing there. We will have home test kits available there. So people could have their pick up test kits. We're not going to be actually doing the tests. There are new variants that have been in the news, and I wanted to go over some of that. The concerns about COVID from China and what variants may be coming from there since they dropped their zero COVID policy. They're seeing a surge, but the U.S. has imposed a testing requirement on people arriving from China. And so far, we've seen no new threatening variants emerging from China. On the other hand, we saw the recent surge in the United States due to the highly contagious BQ1 and BQ1.1. They are subvariants of BA.5. Now these have been, and that was causing the last surge that we're just getting over. Now they're being overtaken, especially in the East Coast and the Northeast and New England states, by another highly contagious variant called XBB 1.5. And that is a recombinant of a couple of different viruses, but it's also related to BA.5. And the important thing to say about this is that these are still sensitive to our vaccinations as well as to Paxlovid, the treatment. That is, it's because we've had so many people vaccinated and the availability of the Paxlovid that this has not caused a much greater surge. Upcoming worldwide, not it is here in California, but not nearly the amount that it is in other places in the world that they're watching, is another recombinant virus called CH1.1. And we have yet to see what that will bring us clinically in reality. It does seem to be more contagious, but all these new virus variants have to be more contagious just to get on our radar. Thankfully, the hospitalizations and deaths have not increased as far as we can see with the new variants. And so again, the vaccines and the Paxlovid are still effective. So vaccinations, news about the vaccinations is that research on the updated bivalent vaccine, which targets and was developed from the BA.5 variant. Excuse me just for a moment. Okay, sorry for that interruption. So yes, the bivalent vaccine, which we've now had in circulation enough for good research to be produced, is showing a very effective vaccine. Currently, unvaccinated people are 2.5 times more likely to be hospitalized and 2.9 times more likely to die from COVID than those who've been vaccinated against the with a bivalent vaccine. Also, the previously vaccinated people who have not had the bivalent vaccine are 3 times more likely to be infected than those boosted with the bivalent vaccine. So if you've been vaccinated and boosted, but you're questioning whether you should get the new booster, it does protect you more. So go out and get the new booster. They're very well worth it. There was one highly publicized report of a safety signal suggesting a possible correlation between strokes in people over 65 after the Pfizer bivalent boosters. I want to be very clear that this was a safety signal that they put into these huge data collection systems like VAERS and VSD as an alert to the people monitoring them that this is worthwhile studying. And it's based on a fairly arbitrary but safe warning threshold. So the signal is actually the numbers passing a threshold, but this is not even a confirmed correlation. And all of the other vaccine surveillance programs in VSD, VAERS, the VA program, and others throughout the United States have not shown a correlation. And actually, there was a recent research article that came out of Israel that showed that there was no correlation, no increased risks from the new vaccine. And FDA, CDC, and our own CDPH all continue to recommend the vaccines and the boosters for everyone over 6 months old, saying that they are safe and they are effective and the most powerful deterrent to another COVID surge. So, of course, we can't see far into the future of the COVID variants and surges, and COVID seems to be a virus that will be around for a while, but now we have a set of proven preventive practices that we advise people of, and we have effective vaccines and treatments. So we're transitioning from a public health emergency response to a more traditional response to this illness. And that means that individuals are protecting themselves with changes in their behaviors, the masking when it's necessary, washing hands, getting vaccines, and so on. And they protect themselves and their families. And when they're sick, they seek out usual medical care through providers. The testing, if they need to isolate, they would do that, but it would be under the advice of their medical providers. So I just want to review what are these current recommendations. Of course, for vaccines and bivalent boosters for everyone over 6 months old. Test if you feel ill before and after travel and before gatherings. And if you don't know the results of the test, then you would also isolate yourself. And if you feel sick and the test result at home is negative, there are some people who will not show a sensitivity to the antigen test the first time, and we recommend if they think they still may be at risk for COVID that they test again the following day. Free tests are available from CDPH at schools, at neighborhood health centers, and at the public health testing sites. And the feds are releasing more free COVID home tests per person, again through COVID tests, COVIDTESTS.gov, or call 1-800-232-0233. This is the same number and the same URL as it's been for months. And these tests are also available through pharmacies. They're paid by insurance and by Medi-Cal and Medicare. In clinics, the only thing that could be charged would be for administrative charges, and that would be if you're not on a Medi-Cal or Medicaid or Medicare. But remember, if you're trying to get them at pharmacies, go to the back desk to request it, where prescriptions are usually picked up. If you go to the front order desk, I'm told, they will put it on as an order and charge you for it. But if you go to the back order desk and you present your Medi-Cal or your Medicare documentation, you shouldn't be charged. Third is, of course, if that COVID test that you do is positive, contact your provider or telehealth, which is a service paid for by California, and that is sesamecare.com. It's sesamecar.com/COVID-CA. I tried to get into this and I left off the COVID CA, and it gives a big website to sign me up for a program, which is a national program, kind of a telehealth insurance program. But if you follow it by /COVID CA, you get a treatment paid for by California if your test is positive and you're at risk, which nearly everybody is at risk. So if you test positive, call this number and you'll get a Paxlovid prescription. Or, of course, you can go to your provider or your clinic and call them and see if they will prescribe it. This Paxlovid is very well worth it. It prevents serious disease and hospitalization and death, and it prevents transmission. And it probably, we're seeing some research that it may also prevent long COVID, but it's underutilized. So reach out for it if you find out you have a positive test and you're feeling sick. It is now widely available, and so we want to encourage everybody to get it. Fourth on this list of recommendations is now masking. It's still the most effective to protect against all of these winter viral infections. So if you get, and that includes, of course, COVID and influenza. So if you get one cold and then you get another cold, and if any of those are COVID or influenza, fine, you've got treatment for that. But even then, some people have 3, 4, 5 infections in a season. This is the time to, for sure, start thinking about using those masks again, because they'll prevent a lot of the other viruses that you may have. They also prevent you from bringing it home to older or more vulnerable friends or family. Fifth is remember to cover your coughs. Sixth is to remember ventilation inside and to maintain safe distances and wash up often. So the sun is coming out today, at least where I'm sitting, and I hope everybody's going to get out and enjoy this sun that we have. It's cold, but hopefully it'll get warmer in the next few days. And I'm feeling a little more confident over the next month or so, at least, from a COVID and infectious disease point of view. So I'll end here, and let me know if there's any questions.
Um, yeah, this is Vicky. Will you be sending those screens out to us so that we can to review? Am I talking?
You are talking.
Okay.
Yeah, what was that?
I think we do make them available, don't we, Cameron? The slides?
Oh, yes, yes. We can certainly send those out afterwards.
Okay, appreciate it. Thanks.
Yeah, of course. So yeah, let's jump right into a question and answer session then. So for the structure, we'll just go kind of one media outlet at a time, and we can hopefully get through at least 3 rounds of questions for everybody. So I guess for each round, try to keep it as like one question. If you want to ask a follow-up to clarify anything, that's great. We're going to try and keep it one question per round so we can get to everybody equally. And we'll also try and intersperse some questions from the public as well. So let's start with Mendocino Action News.
Hello, Dr. Coren and everyone else. Thank you for having this meeting. One question. Yeah. So has there been any changes to FDA approval on the drugs? I know a while back that Pfizer was approved for a certain age up. Has there been any changes for the other vaccines and for the ages?
So Pfizer is approved for boosters now as well, down to 6 months of age. Now, people who have had 3 doses, who are under 4 years old, under 5 years old, who've had 3 doses of the monovalent vaccine, let's say they got it when they were 2 years old, they got their first 2 primary series, and then they also got a booster. They're not, that's the group that's really not eligible for the bivalent booster yet. If people start off their vaccines, they can, for their primary series, they can still mix and match. But the point is that the bivalent booster is available for the first booster down at that age group. For others, I don't think there's been any changes in eligibility. Moderna also has a vaccine that is available from 6 months and up. And I'm sorry I can't be specific about using that booster after the booster with the monovalent. It's not as clear to me. I haven't seen that published yet. Of course, a person could get a booster of either variety after finishing the primary series. Does that answer your question, Danila?
It does a bit. And I just want to clarify that this is FDA approved, not just emergency use.
No, this is an EUA approval, is my understanding. That's right. It's not a full approval yet.
Okay, so the only one that was fully approved was Pfizer for, at one point, the first shot at a certain age up. Is that true?
Not recalling that it got a full approval yet.
Okay,
I think they're all, as far as I know, emergency use.
okay, thank you.
Where that comes into play and is most important is in the school age children, because I think here in California, Governor Newsom was thinking about making it mandatory for children to enter schools once it was fully approved, and it's not there yet. It's not mandatory for school age children to enter school.
All right, thank you, Danila. So Vicky, I know this is your first time here with us. Do you have any questions for Dr. Coren?
No, I think he did a fine job. I pretty much understood everything you said, and I think I'll be able to follow up with having the screenshots. If I need any extra information, I'll look at it then.
Okay, great, thank you. And that was Vicky with
Thank you.
KOZT Radio. Yeah. So let's move on then. So we also have independent coast observer here with us. Susan, do you have any questions? You may be on mute if you're talking.
Hi, can you hear me?
Yes, loud and clear.
Okay, sorry. I wondered if we have any statistics on how many people in Mendocino County have received the bivalent vaccine.
That I don't think we have that separated out at this point. I'm going to check our vaccine dashboard. We have 16% of the county has had the primary series and the bivalent booster. That's just been separated on our dashboard. The people who've had the primary series and any booster is up to 25. So taken together, it's 41%.
Okay, so 16% have had the primary series plus the bivalent booster.
Correct.
Okay, thank you.
All right, looks like back to you, Danila, with Mendocino Action News.
Well, Dr. Coren did answer my second question. I was going to ask about schools, but it doesn't seem like there's any changes there either.
Not yet.
Okay. And then I could just jump about. I just saw a kind of press release that there might be some free COVID tests being offered locally, maybe at public health.
So what we have been doing are these PCR tests and swabbing people's noses on site. We're not doing that anymore, but we will have the home tests. And if people want to drop by the public health department's offices, then we can give out some home tests. And that you would take and interpret on your own. The other places that those are available, as I said, is from the federal government and from various sites, schools and clinics and so on and so forth throughout the county.
I think the public library is also offering them in
Yes.
Mendocino, Ukiah. Yeah,
Absolutely.
yeah, that's all my questions for today. Thank you.
Thank you. And Susan, do you have any more questions?
Yes, can you hear me?
Yes.
Yeah.
I read a press release last week from public health saying that the test to treat sites are being closed in, I believe it was Ukiah and Fort Bragg. I'm not sure where they were, but it didn't mention the Redwood Coast Medical Services in Wallala. Are they still going to be a test to treat site?
Yes, they are. So what's closing here in Mendocino County is the OptumServe contract that we had at the fairgrounds, and then it was also available in Fort Bragg at the VA hall. That contract is ending this week, and the reason for that, and they're ending them in almost everywhere in California, is because the lack of utilization. So we were seeing 3, 4, 5 people come in for those tests, and that was on a good day. And so we've decided that we can't afford to do that anymore, and so we are starting the clinic back up at the Department of Public Health, which is good because it's more the center of town where many people who may not have had the transportation to get up to the fairgrounds, they'll have a little bit more access to it here.
Right, but in Wallala, they don't have access to it. So
But Wallala will still have RCMS.
That's great. That's really good news. I was sorry that wasn't included in the press release somewhere. Um, can I ask a second?
Sure.
Why is the number of deaths in Mendocino County confirmed so different on the public health website that we're now using as a dashboard than the numbers that are being released?
I'm not sure what the difference is. Actually, our website now is copying directly from the state website. So I don't know what other website you're referring to that.
No, I'm talking about the state website, CDPH.
Yes. And why is that different than what's the one you're comparing it to?
Well, today I believe you said 359.
No. 339.
Or was it one?
I'm sorry,
139.
139. I'm sorry.
139. Yeah.
So I hope I didn't say it wrong for the, for the initial presentation.
No,
139.
139. You said it correctly, but it seems to me the last time I looked at the dashboard, which was probably yesterday or the day before, it showed a different number.
Did have 3 others that were confirmed by the state. They had passed away actually most as much as a month ago. But the state goes through its own bureaucratic process of confirming that they're COVID deaths, and then they post them. And so our numbers jumped from 136 to 139. It had been stable at 136 for a number of weeks. It had actually been stable for a number of months at 135. And then it jumped and jumped again. And that's because of the state reporting. But also we had a very stable period of months that we didn't have any deaths. And so that's a good thing.
Right. Well, thank you for clarifying that. It's just a little confusing.
Yeah, well, that's one of the reasons why we changed our dashboard to really reflect what is happening from the state dashboard. It became very, very confusing. Us trying to update and keep up with the state, or the state not keeping up with us, and having
Right.
2 different databases is just, it's confusing. It's not helpful.
Right. The other, if I can ask one more question, the other thing is that Sonoma County, when they report deaths, they're now including the information whether or not the person who died had received the bivalent vaccine.
Now, we're not reporting a lot on each individual death for reasons of privacy. In our county, there's 1 or 2 people who may pass away at a time. And if we gave that information, then, everybody, the neighbors would know who that applies to. And so in a smaller county, when we're dealing with smaller numbers, it's an intrusion of people's privacy, and we don't want to do that.
Well, not to argue with you, because I respect what you're doing.
It's a good discussion.
We could say the same thing about a murder. We're not going to report it because the neighbors would know. So from a newspaper point of view, I think that's maybe not germane. But from a public education point of view, I find it really refreshing that Sonoma County is saying whether or not the victim had received the bivalent vaccine. It started like 2 weeks ago, I think.
Well, we will take that under consideration. There are differences between the size of our county and the numbers of people who are reported. And so it becomes a little bit of an issue that we have to take into consideration. I can't just say, yes, we'll do that. I've gotten in trouble for things like that before.
No, I wouldn't expect you to, but the fact that we've only got 16% of the people in the county who've received the bivalent vaccine, to me, 16% is low. And I've seen that it's even lower in other places. And so it would seem like it's a public health benefit to encourage people to get that vaccine if it is effective. And it seems to be effective.
Yes, it is effective. Well, thank you. I think that's important feedback.
Thank you. I really appreciate your doing these updates.
So I did want to get one question in from the public. And this is actually through the call center, which is a great way to reach public health when it's not media day, if you have a question. Oh, and that's call center 707-472-2759. So the question was, when and how will people know if COVID is increasing again? What's the best way to stay up to date?
That's a good question. So we look at many indicators. We used to put a lot more reliability into the case numbers, the percent positive tests. But with the numbers so low, it's biased and it doesn't tell us a whole lot. So we look a lot more at hospital admissions now and hospitalizations, people who are admitted to the hospital, who have COVID and are admitted because of the COVID. There's a more steady baseline, and it doesn't move up and down as much as cases, and it's not as variable or unreliable based on the reporting of home tests. So that's one way. The other way we know, which is very important, and what's coming online now in more places, is the wastewater surveillance, where they can really look at a community and take a sample of the wastewater from that entire community and reliably see what's happening with the numbers of COVID particles. And in the future, it'll be influenza, RSV. They're talking about a number of other infectious diseases that they can detect in this wastewater. And so in the future, the early situational awareness, the surveillance will come more from systems like the wastewater surveillance. And that's growing really rapidly throughout California.
All right, thank you, Dr. Coren. It looks like it might be back to you, Susan, if you have any more final questions before we wrap up here.
One last question about the wastewater surveillance. It's been going for the longest time in Ukiah. What is that showing us right now about COVID?
Well, actually, wastewater surveillance as a technology, at least for COVID, has only been online for it's probably a little over a year at this point. It's been increasing in California. They just added it for Ukiah in the last month, and we're just beginning to get results out. But because it's so new, we can't really reliably compare and know what's really happening. But we use the wastewater surveillance in other regions of the state, which is much more developed in terms of larger communities that have more wastewater. We have wells in a good part of our county, and we can't do a surveillance program from wells. So we have to look where there is wastewater processing plants to do that from. But there are a few others in some of the other counties in Northern California. And when I look on I look at this at least every week, and they publish the information. And the data that they're getting from the Northern California counties is so far not sufficient to even publish to see what's happening. I mean, soon it will be, but at this point it has not been. So we're not really far behind in this movement for this technology, but we're far behind that we don't have data that's reliable from each wastewater district. And we're putting more online. We'll have more time to see how it goes, and we'll probably be able to see trends. You need at least 3 reliable points to say, oh, this is a trend, it's going up or it's going down. And we just don't have that data reliably yet.
I see. Thank you for explaining that.
Sure.
All right. Well, Dr. Coren, do you want to have any give any closing comments or recommendations before we wrap up?
Well, I would just say that we're in a better place now than we were last year. We have the very effective vaccines. We have very effective treatments. And the numbers have not gone up dramatically. We think it's because of those two things, as well as a change of behaviors in the community. People are recognizing their symptoms, getting themselves tested, and if they're tested, they're staying home from. If they're positive, they're staying home from work or school, and they're self-isolating for the duration that they're infectious. So we're in a better way right now. There still is a future that's got some questions, but we're trying to wind down from a public health emergency to a medical. It is still an epidemic, but it's coming under more control. So the main thing that I would say for people now that we're in the winter season is follow the instructions that you know are good. You should be getting your vaccines. If you're sick, you know what to do with that. You can stay home, get yourself tested with a self-test, or go to a clinic, or get your self-test back from the pharmacy or somewhere else and test yourself. You know how long to stay home. If there are questions, call our call center or call your primary care providers. But do what you can to stay healthy in all the other ways we try and stay healthy. And part of that, now that I'm looking at the blue sky, is to get out there and take walks and eat healthy, and watch for symptoms of disease. I do want to keep pushing masks because they'll protect against all of the viral illnesses that are going on in the winter. But we should take advantage of the fact now that we're coming out of this most recent surge, and I think we have a respite for a while. So stay well.
Thank you, Dr. Coren, and thanks to everyone that tuned in today and asked questions. So we'll continue to have Media Day on the third Friday of the month. So that means in February, it'll be Friday the 17th, 2 p.m. In the meantime, you can check out our Facebook page, the website, or also get in touch with the call center, and that's 472-2759. So thanks again. Have a great weekend.
You too.
Bye.
Thank you all.
Bye. Thanks.
Thanks.